Hi everyone. I wanted to walk you through the first discussion case and give you some feedback on the Cheryl Hanachek scenario. And that scenario clearly involves the issue of abandonment, which was introduced to you this week. And the pivotal question in doing the analysis for Dr. Canetto and Dr. Sims is whether the doctor-patient relationship is in existence. So let's first deal with Dr. Canetto. And to do a real analysis of this case, you're going to have to make some assumptions about facts or supply some facts that were not given to you in the scenario. And some of the questions that I would have are, did Dr. Canetto continue to provide Cheryl GYN or pap smear uh, treatment after the birth of her first child? Is it common in the industry to assume that a patient for whom you've delivered their child remains your patient? Or is the pregnancy within the industry or medical practice considered to be the end of that relationship? And if that's the case, was that communicated to the patient? So what's really interesting here is not just what is standard within the OBGYN practice, but also some thought should be given to what should a patient reasonably rely on. Is it reasonable for a patient to assume that the physician who delivers my first child will deliver all subsequent children of my subsequent children? And the reason why this question as to what is common in the industry or what Miss Hanachek assumed is because that all goes to the requisite duty in this case. Was there a duty of care to officially terminate through written knowledge, or is it just expected that at the end of the birth that the relationship is over? In this case, I think that what's interesting is I think it can go either way. And I will really be focusing on the extent to which you supplied some additional facts or assumptions or even questions to substantiate the final determination that you made in terms of whether Dr. Canetto could be held liable. Did she rather properly terminate the doctor-patient relationship? The second case, Dr. Sims, is a little trickier and focuses on a different set of issues. Here, your analysis will come down to, did the receptionist initiate the doctor-patient relationship by providing medical advice to Ms. Hanachek while she was on the phone? That also goes to, and if she did, then in fact, the doctor would be liable. And while we'll talk about this a bit more throughout the semester with the concept of vicarious liability or agency, that is a very important aspect of this case. Now, another issue in this scenario that often comes up is it okay for a physician to limit his or her practice? Wow, attorneys are really litigious. Advanced maternal age attorneys with twins, wow, they might be super litigious. I prefer not to take any of them. Is that okay? What's interesting is, for the most part, physicians have the right to craft their practice full of patients of their choosing. Now, there are some hot button issues under discrimination that you could not discriminate against certain people for that. However, because the discrimination in this case would not be against all women, certain types of women, attorneys, advanced maternal age, people without health insurance, all of those are fair grounds for a physician to limit their practice. I will be keeping these thoughts in mind as I read your postings, and if you have any additional follow-up questions or insights, I encourage you to post them on the discussion board under this Professor Musings section.